Good afternoon. I am Dr. Krishna Prabhakar, Senior Consultant Physician Intensivist from TXHospitals in the Banjarals branch. We all know that one of the major hidden and ever-growing, I would say, yes, I would use the word ever-growing problem in the current scenario would be obesity and its challenges. We all know that this particular problem is there in all age groups, starting from childhood to middle age to adulthood to even to elderly people. This is one problem which is quite common, and there is no male or female dominance, and they say that females are more prone to this, but yes, even males are no less affected with this. And obesity is one particular disease which involves all the organs in the body and all the systems of the body and makes its impact in a very huge way. So coming to the most common thing, what causes obesity? So as we all know, obesity is nothing but excess weight in the wrong places, to be precise in a very colloquial language. So usually this particular excess weight is measured by a measurement called body mass index. It's a small formula which we calculate with the height and weight of the patient and come to a number which defines whether the person is in the overweight category, obese category, or morbidly obese category. Like if someone is in the BMI of 25 to 29, we call them as overweight. Anything between 30 and 39, we call them as obesity, and anything beyond 40, we call them as morbid obesity. So we would like to know how this particular obesity has influence in other organ systems. This is the most common question people ask me. Then what's wrong if I'm fat? What's wrong if I'm to the obese side? We need to understand that this particular excess fat which is deposited in various parts of the body, including the subcutaneous tissue, which appears to be the obesity's major problem, has got immense organ influences and organ system influences. For example, this amount of fat which is laden on the liver, which we describe as fatty liver, again graded as 1, 2, 3, has got significant effects, and the entire spectrum of such fat deposited liver diseases come under a condition called NAFLD, that is non-alcoholic fatty liver disease. It is a self-explanatory word which determines the cause of the liver disease would be excessive fat deposition. And the excessive fat can also have a huge problem on the skeletal structure in the way of osteoarthritis or worsening osteoarthritis. The excessive fat or obesity can have influence on even the reproductive system in causing one of the foremost causes of infertility and polycystic ovarian disease in women. And this excess obesity, even if it shows a lot of physical effects, the most untold by the patients and the most unattended by the clinicians would be the mental issues which are associated with it. Please try to understand, obesity is a condition which has got physical and even mental effects on the particular person. I wouldn't use the word patient, but the particular person, especially women and growing children. So we need to identify this problem at an early stage, try to understand the reasons behind it, look at the investigations required to know if there is any secondary cause for it or any other reason for the cause for it, and chalk out a treatment plan which is pertaining to that particular problem with the particular reason, rather than treating obesity as a whole. Identifying the cause for it would be a much beneficial factor for the patient here. What are the common populations which are having this obesity issues? So initially it was proclaimed that obesity happens only in patients who are in well affluent families or families with above the economy level or the high affluential families. It is sad to know that this obesity is also creeping into the below poverty line or even below a socio-economic status line patients also, with the reason being the availability of food, especially the simple carbohydrates and the simple fats which are at a lesser price, where these population people are highly prone to have them. So socio-economic status initially had an influence on this, but currently obesity does not spare any individual of any socio-economic status if it is not kept under check. There are also a few medicines which cause obesity or increased weight. The most common example, what we have seen during the pandemic time also, is the usage of steroids. Steroids are medicines which are used in various clinical conditions, including the COVID which we had recently, and one of the important side effect of the steroids would be weight gain in the form of water accumulation. And there are many other medicines like this which cause increased weight gain and which are used for various medical conditions. Children, as I discussed earlier, are not spared from the obesity part of this. As we know that the easy availability of fast foods, easy availability of simple carbohydrates, simple sugars and high fatty foods available easy to the children, and the ease of procuring them, this particular obesity has creeped into the children population also, which definitely will make them will make a big mental impact to them, and also not able to be a part of their peers, and having tough time and not understanding what is wrong with them with the ongoing obesity problem. So as we all know, obesity per se has got lot of effects on the human body and its systems, but definitely there is a direct correlation on the cardiovascular system in the form of coronary artery disease or worsening coronary artery disease. It has got a direct correlation to the cerebrovascular accidents like strokes and ischemic attacks. It has got a direct association on the gastrointestinal tract or the stomach tract, where it involves a lot of NAFLD, which we discussed earlier, and also it is one of the important reasons for cholelithiasis, stones in the bile duct and the bile apparatus. And there is other involvement which in other systems, like we discussed, like in the form of infertility in the part of reproductive system, PCOD in females, and in pertain to the joints which maintain a skeletal structure, this excessive weight puts immense weight and load on the joints, especially the knees, and these are the ones who have got early osteoarthritis of the knee joints. So coming back to the long-term complications, we try to understand obesity is not a disease, it is part of a spectrum, and it is one of the important metabolic causes and metabolic diseases which is quite rampant in the 20th century. We need to understand that obesity has got a lot of long-term complications, and the most important would be the coronary artery events, stroke events, and also events pertaining to the endocrine systems or even infertility and many other. So it is more like a multi-organ system involvement, and if we can take up with the addition of the other chronic diseases like diabetes mellitus and hypertension with obesity, is going to be a very tough combination and to treat it, and the management entirely differs in such patients with all these three conditions. With inclusion of high cholesterol levels also, we can come to a conclusion of a syndrome called syndrome X or metabolic syndrome, which is also one of the important factors for very detrimental diseases like stroke and heart diseases.